we have more and more patients that are referred for implant failure. So if you look, the number of implants that were placed last year in the United States was about 5 million implants. So 5 million implants, if you take a success rate of 92 to 95%, depending on what the literature tells you, you reach roughly a total of 200,000 implants that fail. If you look at these 200,000 implants that failed, you have about 40,000 implants that fail because they do not integrate. That means at the time of the placement and the complication, they are in a certain way rejected. And the rest is what we call the secondary failure. That means about 150,000 implants that fail after they had been restored. That means the crown has been placed. So, to answer to your question, implant failure can result from many factors, and one of the major factors is the occlusion. Occlusion, that means the way the teeth come together when you bite, and if you have a bite that is has not been properly set up, and you have excessive forces that are applied on the implant, and that stress the implant, but stress also the surrounding bone around the implant, and that result in the simple case with a loosening of the crown. And most of the time you observe a severe bone loss, you observe a complete failure of the implant. So that's why a proper treatment of the bite and proper evaluation of the bite and proper preparation of the patient before receiving an implant, that means we have a lot of time to do an orthodontic treatment, to do expansion, that's what Dr. Evans do. We have to set up the case, as we say, before placing an implant. And occlusion here play a major role in this failure, because I told you 40,000 implants fail because they do not integrate, 150,000 implants fail and after, once they are restored. And like one of my teachers at the University of Pennsylvania used to say, Lenny Abrams, he used to say, occlusion is a weapon. That's why a proper treatment of the occlusion before any placement of the implant is crucial. And that's what we see in our practice. Most of the failure, this is secondary failure, that are because the bite has not been set up properly.